This is my student support system. Keep watching, keep learning.
Hello, good morning. In today's class, we will discuss about cataract. This is very important topic. This lecture is in English, and if you want to study in Hindi, just click on I button and you will get link of Hindi lecture, or you can directly visit to channel My Student Support System. Let us see what is cataract. A cataract is defined as a lens opacity. Here you can see in the eyes, the lens is opaque. The cataracts are a leading cause of disability, visual disability among older adults. What are the causative factors? Most cataracts are age related, means they are senile cataracts, but some cataracts are associated with other factors also, such as blunt or penetrating trauma into the eyes, congenital factors such as maternal rubella, and radiation and ultraviolet light exposure can also lead to cataract. And sometimes side effect of certain drugs may also lead to cataract, such as systemic corticosteroids or long-term topical corticosteroids. Ocular inflammations such as retinitis pigmentosa, and the patients with diabetes may also tend to develop cataract in younger age. Clinical manifestations. What are the signs and symptoms of cataract? The patient with cataract may complain of a decreased vision, abnormal color perception, and glare. The glare is due to light scattering caused by lens opacities, and it may be significantly worse at the night when pupil dilates. The patient with cataracts may complain of decreased vision, as we just have studied it. Skip करेंगे. Types of cataract. Main clinical types of cataract are three: the nuclear cataract, this one, cortical cataract here, and posterior subcapsular cataract. In this picture you can see. Now we will discuss them in detail one by one. Nuclear cataract is caused by a central opacity in the lens and has a substantial genetic component. Its causative factor is normally genetic. It is associated with myopia, which worsens when the cataract progresses. If dense, the cataract severely blurs the vision. Cortical cataract involves the anterior, posterior, and equatorial cortex of the lens. The cataract in the equator or periphery of the cortex does not interfere with the passage of light through the central part of the lens, so it has little effect on the vision. And third one is posterior subcapsular cataract. It occurs in the front of posterior capsule. This type of cataract typically develop in younger people, and in some cases it is associated with prolonged corticosteroid use, diabetes mellitus, and ocular trauma. What diagnostic investigations are done? Decreased visual acuity is directly proportional to the cataract density. The Snell visual acuity test, ophthalmoscopy, slit lamp biomicroscopy, these are the examination of tests which are done for the patients of cataract. And main thing is to check the visual acuity. If visual acuity is okay, then no need for surgery. Treatment. No medical management can cure or prevent cataract. Surgical management is done to improve vision. Surgery is performed on an outpatient basis and usually take less than 1 hour, with the patient being discharged in next 30 minutes or less. When both eyes have cataracts, one eye is treated first, with at least several weeks or months separating the two procedures. This system gives time for the patient and the surgeon to evaluate whether the results of previous surgery were adequate or not. So it is good. Then another procedure is phacoemulsification. In this method, the extracapsular cataract surgery, a portion of anterior capsule is removed, allowing extraction of the lens, nucleus, and cortex, while the posterior capsule and zonular supports are left intact. An intact zonular capsular diaphragm provides a needed safe anchor for the posterior chamber intraocular lens. So this intraocular lens is inserted here, and this lens is supported by the posterior part of the lens. So it is very easy to apply. Before discharge, the patient receives verbal and written instructions about how to protect the eye and provide care after surgery. The nurse instructs the patient and family in applying and carrying the eye shield or protection. Sunglasses should be worn while outdoors during the day because the eye is sensitive to the light initially. The eye patch or shield is removed after first follow-up appointment. The patient may experience blurring of the vision for several days or weeks. Vision gradually improves as the eye heals. And in patients with intraocular implants, they have functional vision even on first day after surgery. Thank you students for watching this video. You can subscribe the channel for latest updates, and you can like Facebook page, and for making your notes you can visit mynursingstudents.blogspot.com. You can follow me on Twitter, Instagram, and join Facebook group Nursing Notes. Thank you. Have a nice day.